Every day in the United States, thousands of people go to the hospital to be treated for life-threatening illnesses such as heart disease and cancer. But right now, due to the breakdown of a nuclear reactor in Canada, many of these critical procedures are being delayed and compromised. The United States is facing a crisis in nuclear medicine. We face a severe shortage of a crucial radioactive isotope, which is required for nearly 50,000 medical procedures every day, usually to produce a detailed image, such as a cancer or a bone scan. The shortage of this isotope, which usually costs only $10 of a multi-thousand-dollar procedure, is threatening the health care of millions of Americans. Worst of all, the United States does not currently produce any of the isotope domestically. Instead, we are entirely dependent on a handful of foreign nuclear reactors, most of which are several decades old, some of which are literally falling apart, and which rely upon weapons-usable, highly enriched uranium for their operation. In May, the 51-year-old Canadian NRU reactor broke down. It is not yet clear whether the reactor will ever operate again. In mid-July, the 47-year-old HFR reactor in the Netherlands was taken offline for maintenance for 1 month. Together, these two reactors usually produce our entire isotope supply. While the United States was able to secure a small supply during this time from other reactors, Americans' health care suffered as a result. A recent survey of the nuclear medicine community provided sobering results. 80% said their practice was impacted by the shortage. 80% said they had postponed procedures. 47% said they had canceled procedures. And 57% said they had substituted alternative procedures. Unfortunately, in most cases, the alternative procedures are more invasive, less effective, more costly, and pose greater radiation risk to both patients and technicians. We don't need alternatives. We need the state-of-the-art to be fully available again. Medical care in this country for cancer, heart disease, bone scans simply cannot be held hostage to the maintenance schedules of a 50-year-old reactor in Europe. It is absolutely vital that we act to bring a robust domestic supply of these critical medical isotopes online as soon as possible.